As cases drop, is there an end to the pandemic finally in sight? Let's bring in Dr. Dan Shirley with UW Health to put that question to him. Dr. Dan, thanks for joining us.
Thanks for having me.
So as we look at the numbers, we were at 15,000 cases a day in Wisconsin a month ago. Today we're under 1,000. What happened that we just fell off so quickly?
Well, really, it's a combination of things. I mean, people were good about getting vaccinated in Wisconsin. And then there also were a lot of people that got Omicron infection, and that sort of added to the short-term protection. Added to all that, of course, is the layers of protection we've talked about before about social distancing and masking. And all of that together has really made a big impact.
So when we look at the sheer numbers here, we've got more than 60% of the state vaccinated. We've got more than 1 million people in the state who had COVID at one point or another in the last 2 years. You know, do we have enough built up immunity one way or the other in the state that we're not going to see a spike like we saw in the last 2 months again?
Well, I think all of us hope that's the case. You know, there's a lot of things that are difficult to predict related to that. I think in the short term, all of that really does probably help protect us. But there's a lot of things that could happen, including other variants, for instance. So I think the good thing, of course, is that having the cases low allows us to do that kind of surveillance, really put some attention to cases when they happen, and be on the lookout for new variants and everything like we did last time that needs to be put into place to prevent that kind of stuff.
What are the chances we do see another variant, another Delta or Omicron come in and spike the numbers again?
Well, I think it's really likely there are other variants because that's happening all the time. Whether it changes enough or really changes so that it's impactful like Delta or Omicron, that's really a big question. But you know, the things that we know that prevent COVID here also need to kind of be implemented worldwide so we don't end up with another variant. That's really the key is sort of dispersing some of this same knowledge and resources really through the world so we can keep cases low everywhere.
Do you foresee this summer looking like last summer where cases were so low it was almost undetectable in the population?
I hope so. And I think that's kind of at least what we're planning for, knowing that we also need to watch for a rise in cases. But if it really is low level and intermittent cases, that allows us to do sort of more intensive tracking and case finding and that type of stuff, which really lets us get on the early train if there are cases that start rising.
Dr. Dan Shirley, thank you so much for joining us this afternoon. Always great to have you. So with that drop in cases has come a drop in vaccinations and boosters. This number on the left there, 60.3, it's only up 0.1%, I think, in the last 2 weeks. About 2/3 of the population, though, fully vaccinated. That mirrors the national rate. When it comes to boosters, a little more than 43% of the fully vaccinated population has been boosted.